Hi, everyone. Thanks for joining LA Beauty Connect today for our interview with Dr. Villanueva here in Beverly Hills.
Hi, Dr. Villanueva.
Thank you for having me.
Can you tell us about Atlas and Atlantis?
Sure. So the Atlas procedure and the Atlantis procedure are my variations of high definition liposuction. The Atlas is high definition liposuction and the Atlantis is high definition liposuction with fat transfer. And what those names stand for is anatomically true lipoaspiratory sculpting is the Atlas, and the Atlantis is anatomically true lipoaspiration and transfer with sculpting. And the transfer is the key difference between the two. Now, the reason it's my variation of high definition liposuction is because in traditional high definition lipo, as being taught at a lot of our meetings and national meetings and things like that, the procedure is done in a way that you intentionally leave fat to create the illusion of contour. And what I'm speaking about in particular is actually the abs. You actually leave extra fat over the abdominal muscles to create the illusion of contour. Now, what I do differently is there's two layers of fat in the body. You have your skin, you have superficial fat, and you have deep fat. I actually remove all that fat in that deep layer. And only in specific areas do I provide some highlights in that superficial fat to create the definition that shows the proverbial Pilates lines, right? And by doing it in this way, we're getting much softer, much more natural appearing abs that actually age well. Because unfortunately, as most people age, even though they do their very best to stay lean and stay fit, the body does have a higher percentage of body fat with time. And so not only are we thinking about patients now, we're thinking about patients tomorrow, and we're thinking about patients in the future to make sure that that sculpting that we do lasts with them.
Can you tell us about liposuction for the patient that's a bit older? Maybe their skin is crepier or has lost some of its luster.
For sure. I think it's really important when you're considering liposuction, and especially in various age groups, that you take skin elasticity and skin aging into consideration. And so a general rule in our practice is anybody over 30 or anybody that has had more than one pregnancy before the age of 30 should consider doing something for skin elasticity to treat it. That something is very unique and it depends on genetics and anatomy and it depends on each patient. And if a patient's had a lot of weight loss, that also kind of goes into the mix. But the two solutions are a less invasive option doing something called Renuvion that uses plasma energy and radio frequency to tighten the skin from below as a one of the steps in the procedure, or we do a skin removal procedure like a tummy tuck, right? And so it's really important to take these things into consideration. But another thing that's really important based on age, genetics, and skin type is the crepier, the texture of the skin, which is something that's not necessarily addressed with the liposuction or the skin tightening with the Renuvion, and that's treated at something more of a superficial level. And you can get as superficial as doing like a resurfacing laser to help improve the elasticity, color, and tone of the skin. Or you do something in between the top layer of the skin and the deep layer of the skin where the liposuction or Renuvion works is something called Morpheus 8 that uses radio frequency needling to improve the collagen and help diminish the texture of the skin that is sometimes seen as we age.
Do you think that any of the collagen supplements and powders that everybody's running to eat help?
So that's a great question. If you would have asked me this question about 15 years ago, I would have said no. Because what you learn in medical school is that a lot of these molecules are broken down in the gut and you absorb the amino acids. You don't absorb the whole product in the form of collagen, right? Now, there is some interesting data that's starting to come out that's showing some benefit. And the truth is that if there's some benefit and really very little harm, if not no harm at all, then supplementing is fine. And I think that being judicious and being careful and understanding the study behind what you are taking is very, very important. But at the same time, I think dismissing everything that's not, a prescription, I think is also not fair either, because there is a lot of things that we're starting to see, even with red light therapy. Not that long ago, everybody thought it was, this voodoo thing that there's no changes. And as time has progressed, a lot of people believed in it and started doing clinical trials and started doing studies that show that there is benefit to the skin, there's benefit to hair growth. So there's a lot of things that are coming through for things that were initially washed away.
Can you get lipo in the same place twice?
Yes, you can. I think the key with that though is going to somebody that is an expert in liposuction. And the reason being is that when you have liposuction done, whether it's the first time or whether it's the second time, after the first time, you create scar tissue. And that scar tissue kind of encases some of the fat that's left behind. And so going back in and treating an area again, it's very important that the surgeon understands revision liposuction and has an expertise in that, because you can get into issues with irregularities, meaning lumpy, bumpy skin, going back a second time in an area with somebody that's not familiar with how to do revision liposuction.
If you get liposuction in one place, does it travel to another place in your body?
Right. So that's a great myth.
Yeah.
And we are going to debunk that myth today. So the fat does not transfer or move anywhere else. That myth actually originated with early liposuction. And in early liposuction, what docs were doing was treating one area. So they would treat just the lower tummy, right? And if you think about it, in the body, once you go through puberty, the total number of fat cells that exist in the body is kind of predetermined, give or take a little bit, right? And so once you go through puberty, you're not really going to create more fat cells. So when you do a liposuction procedure, you're removing the total number of fat cells in the body, particularly for that area. Now, when you gain and lose weight, the body fat cells get larger and smaller with gains and losses of weight. You don't actually increase the number of fat cells or decrease the number of fat cells when you're within, 10 to 15% of your body weight. And so what happens is that when you had one little area that you treated in the past and then you gained weight, there's more fat cells around that area. So it looked like the fat was going somewhere else. But now when we're doing total body procedures that we're creating harmony and balance between the front, the waist, the trunk, and kind of doing this global liposculpting procedures, when there are gains in weight, the areas that are not treated are not actually getting much larger because it's in proportion to everything else, because we've treated the entire trunk, right? And so fat doesn't actually go elsewhere. What you'll see is in some areas, if there wasn't diligence paid to how the proportions are in the body, then you'll see an area get fuller because there's more fat cells in that area, but not because the fat is actually going somewhere else.
Can you explain what Galaflex is?
Galaflex. So Galaflex is a soft tissue support system that it looks like a mesh, but it's not a mesh. Mesh is actually, unfortunately, a dirty word in medicine because everybody has seen those daytime commercials. Do you have this type of mesh? Let's go sue the company, right? And the reason that those meshes have a lot of issues is because those are permanent meshes. Galaflex in itself is a dissolving product that looks like a mesh, but it's actually a tissue scaffolding. So what it does is it helps your body create collagen to increase the strength of the tissue. So when you're doing a breast lift or you're doing a breast lift with an implant, that Galaflex acts like an internal bra, and it helps support the tissues, or it helps support the implant so that it puts less stress on the tissues over time. And the Galaflex itself actually dissolves into carbon dioxide, which you breathe off, and water, which you excrete through your body. And as that process happens over 18 to 24 months, your body replaces it with collagen. And there's studies that have come out recently that show that that collagen is actually 2 to 4 times the natural strength of tissues that have healed. So not only does it, anytime you do surgery, it's actually, the tissues are about 80% the strength of a natural tissue that hasn't been manipulated on. So it's actually a little bit weaker than natural tissues. And so by putting the Galaflex, you're actually augmenting the strength of those tissues 2 to 4 times that of natural tissue strength, which makes the results last longer.
Thank you so much.
Well, thank you for having me.